training for their general surgery residents. And Leaf is going to take the second half of this session to talk about his work with Dr. Price on Cambodia. Want to go ahead and give us an update on what you have been working on?
Yeah, I'd love to. Thank you. Thanks, Mary, for presenting. That was really interesting stuff. I'm excited to see where that goes. Let me share my...
Thank you. Thanks, everyone. We'll see you.
Go back to your rotation. Bye.
Okay, can you see my screen?
Yeah, looks great. Go ahead.
Okay, so I'm excited to, I guess, some background about me. My name is Leif Sorensen, and I am a current undergrad and master's student here at the University of Utah. Just finished my MCAT, so I'm applying to medical school this spring. So very excited about looking forward to those next steps. And I'm excited to have Jack Richards here, who is Dr. Richards' son, who is getting interested in working in Cambodia, and he wanted to kind of learn more about what we're doing. So with Cambodia, this is a progress report on kind of the laparoscopic cholecystectomy training that we've been doing. Specifically, I'm going to be talking more about Kampong Cham, but I wanted to give you a quick overview on the background of what we've done and kind of some information about Cambodia. So Cambodia is a fairly large country with over 16 million people. And when we first started this program in 2022, they had no real formal laparoscopic training program. So this was approached to Dr. Price by the LDS Church to help bring this program to Cambodia and establish a formal training center in the capital of Phnom Penh. Since then, we've established 3 laparoscopic training centers and hosted over 5 training courses with our colleagues in various of those training centers throughout the country. The main goal is to help facilitate a laparoscopic cholecystectomy education and to train residents and surgeons on how to perform laparoscopic cholecystectomies. So the methods that we approached in trying to create this program, at least some of them, was to build a laparoscopic skills training course that involved didactics, curriculum, hands-on simulation training, various tasks to learn how to use the laparoscopic equipment. Then in conjunction to teach a 2-week in-person hands-on cholecystectomy course, or a train the trainers course, as we call it, where surgeons and residents work side by side with surgeons from various places throughout the world and here in the University of Utah on how to perform safe cholecystectomies and to learn kind of the methods and the way that we approach it. Then, although not exactly 7 months later, what was really important for us is follow-up training to implement this and really focus on quality, then to come back months later to go over the training again and to make sure that what they're performing is quality surgery, it's safe, and that they feel comfortable in what they've learned. Then the last thing is in the various countryside areas, a lot of them still use paper as a data bank to collect information on their patients, which has been very difficult for them and for us in trying to find information because the pages can get lost. They can forget where they placed them, they can get damaged. And so really trying to help support them in other methods of data collection so that that way they can have better access to that data when they need. As you can see, here's a picture of what the data collection looks like there, and then a picture of one of our surgeons that was training where to place the ports. Here's some more quick pictures of what it looks like. On the left is a train the trainers kind of day-by-day hour breakdown of what the course would look like, and then some various tasks that we helped create at one of the surgeons teaching it. So specifically, I'm talking about Kampong Cham, which is a rural countryside area that we helped focus and bring laparoscopy to. They have a population of around 900,000, and the regional hospital there was just recently remodeled by the LDS Church with a $1.5 million donation to rebuild the operating rooms to allow laparoscopic equipment and to kind of overhaul the hospital to prepare for our training course and the work that we were going to do. Previously in Kampong Cham and at their one regional hospital here, there was no laparoscopic equipment or formal training on how to do laparoscopy. So any surgeons that were trained received it at different places outside of the country, or maybe have seen it once or twice, but there was no real formal training. There's some numbers on what the hospital's kind of staff looks like. So this was from 2022. This is the open cholecystectomy cases from Kampong Cham that we've then collected from the paperback data, and I've put in as a breakdown month by month for you. The important thing to note is that it's 49 cases This did not include complications. It did not include how long they stayed. A lot of information that isn't recorded or very difficult to get. But what we do know is just how many they did. So this happened before we came. Another quick picture of our team then going to Kampong Cham. We've now gone twice, 3 times to do these training courses and then teach the hands-on as well. So you can see some pictures of the team. Dr. Peng Leap in the bottom right in his University of Utah hat that he has. And then this is the real bulk of the data that I'm excited to share with you all, is that this is now from January 2023, the start of when they just did open cholecystectomy cases, to then the switch to laparoscopic from our first trip in February of 2023, to then the progression all the way up to January of 2024, this month right now. Important numbers to note, this time frame, they have completed 148 cholecystectomy cases, with 125 of those being laparoscopic, 18 of those being open, and 5 cases switching from laparoscopic to open due to various difficulties during operation. You can also see something interesting. The most cases that they had were during the trips that we went on. So first trip in February, second trip in September. Here's kind of another breakdown of that for you. You could see in 2022, no laparoscopic, 2023, 125 of those cases, 18 open, 5 switch, 2024, 11, 1, and 1. The important thing to note here is there was a 302% increase in the number of cases done in 2023 compared to 2022. And as Dr. Price, my mentor, always talks about, something important to note with that is not necessarily that now they're going out and looking for more cases to do, but more in fact that now that their treatment options have opened up with laparoscopy, more difficult cases or cases where people were hesitant to receive laparoscopy due to length of stay or cost or missing work are able to now reasonably get this surgery because they're able to recover more quickly and get back to what they're doing. Another interesting point is that the spread of laparoscopy. Although we went and taught at the regional hospital, one of the surgeons, Cy Boren, who is there, actually has his own private clinic that he operates in. And so since the teaching of laparoscopy in Kampong Cham, we've seen an expansion to even the private sector within Kampong Cham, with him doing 14 private cholecystectomies that had no complications, were done safely, and the patients all recovered fine. So it's very exciting to see the spread of knowledge that starts to go through a region and the excitement there. These were the notable cases that came from this data in 2023. Of the 148 cases, 2 of them, they had T-tubes that were placed. 4 colodoco duodenostomies were done, 5 switches from laparoscopic to open, and then 5 second surgeries where, due to various complications in the first surgery, the patient had to come back and receive another surgery at a different time. And when we first started the data collection, they did not record the length of stay. Like I said, they've really made leaps and bounds in updating and how they record data. And so we really pushed on that second trip if we could start to get the length of stay for the patients. So from 7-1, when we went that second trip, we've collected that, and the average length of stay is around 4.37 days. So some conclusions that we've learned from this is that the number of cholecystectomies done in 2023 is increased by 302%. The surgeons at all various training centers throughout Cambodia have improved times and scores from the first time that they started the training versus now. And the surgeons have expanded knowledge of laparoscopic surgery and improved data collection methods, which is one that I'm very excited about, that was not necessarily a focus, but I think is going to have great kind of feedback down the line for us. Our future plans, we want to continue to expand this course as long as funding and excitement and everything is available for us and things work. We want to continue to follow the patient outcomes to make sure what we're teaching is still safe. Course efficacy, do we need to improve? Is there areas within the course that are maybe lacking? Create possibly even an advanced laparoscopic course. In Calmet, Phnom Penh, the capital city, we've really received a lot of feedback that they love the course that they've received, but they want more. Cholecystectomy alone is a basic surgery, and they want to expand their laparoscopic capabilities by getting some more specialized surgeons and coursework in. And then finally, our last goal, although still optimistic, is to hopefully publish a paper by May at least to start working on that and get that by the summer is the goal. I'd like to acknowledge all the various faculty and staff that have helped. There's many, many more than just this, but this was here at the center that I wanted to mention specifically, and the LDS Church for sponsoring this and paying for this work. Thanks.